Now, you both mentioned that, there's a need for sort of everybody to look at the patient. So this team approach, we're very much about team approach. So what is the team that is in the osteoporosis world around this patient? So there's the primary care doctor, but who else is there that's around that may be helpful? So Dr. Jain, do you want to sort of talk about the team approach of this?
Absolutely. So at the center of the team, of course, would be the patient. And as you mentioned, family members who may have seen that grandma or grandpa is getting weaker, having falls, so they can bring this to the attention of their healthcare provider as well. So it has to be both a patient and a relative with open communication. And the family doctor is a very important part of that team. As Dr. Brown pointed out, unfortunately, in our stratified medical care system that we have, sometimes the family doctor may not be aware of what has transpired in the hospital, if there was a hospital visit, an ER visit. So I think it's really important that, especially if you've had a fracture, to bring it to the attention of your family doctor so that automatically those flags go up about thinking about osteoporosis, the management of that, if needed, seeing a physician that specializes in bone conditions would perhaps be indicated. By that same token, allied health, very, very crucial. So we have pharmacists who are a very crucial component of this team, chronic care nurses, all of them are very, very crucial. So I think it takes a village, and certainly it takes a village to continue to maintain the bone.
So therefore, everybody will be actively participating in this. And I guess maybe I'll finish up with the patient empowerment, because the patient is in the center of this. And if you think about it, the patient is the one that will benefit the most from not having a fracture and not ending up in long-term care and not needing to use, a walker and those kinds of things. So what do you tell patients in terms of how do you empower them? So Dr. Brown, I know you're a huge fan of getting patients to be empowered. This is not like a diagnosis of cancer where there's not much they can do except things are done to them. So how do you explain that to patients so that they sort of take on this, that they have a powerful place to play in this osteoporosis paradigm?
So I sometimes use a sports analogy. I sometimes say that osteoporosis is a team sport, and we're all on the same team. Your doctor may be like the coach, and you may be the star player as the patient, but you need everybody on the team. You need the pharmacist. You need the front desk staff to book you in for that appointment. You need the physiotherapist. You need your team. And what I want patients to understand and what I want them to feel good about is that this is all about keeping them in their home, in the community, not in a long-term care facility, keeping them independent, active, if possible, driving, going to their yoga classes, doing the things that they want to do as they age. Because what I don't want to see for them and what they don't want to see for themselves is they don't want to be in a long-term care facility, sitting in a wheelchair, parked at the elevators because the only action for the day is who comes on and off the elevator. And that's incredibly sad. And I spell it out like that. To me, osteoporosis is all about independence. And my job as a family doctor is helping you keep independent, but I can't do it without you on the team.
Great. That's a good, inspiring kind of conversation for Dr. Jain. Any inspiring words for the patients as you're sort of telling them that they have osteoporosis?
Yeah, I always feel that, especially for osteoporosis, more than any other condition, prevention really is the best cure. But God forbid, even if you've had a fracture, make that the last fracture. So that it's really important that we are able to continue to protect the bone, and really, as Dr. Brown's put it so eloquently, making sure that we have our seniors in their homes and away from facilities is really the best thing or the outcome of treating osteoporosis.